Our second panelist this afternoon is Jolene Mullins. Jolene Mullins is the Liberia Country Director for Project Concern International. She served as a Peace Corps volunteer in Liberia 35 years ago, and I can share with her the joy of going back to where you served as a Peace Corps volunteer, and I congratulate you, Jolene, on the successes that you've had. The school that she helped to build as part of her work as a Peace Corps volunteer is still standing. She arrived back in Liberia in 2013 and has stayed in the country throughout the Ebola epidemic, working with an all-Liberian staff to build capacity, resilience, and raising community awareness about good health and nutrition. Jolene has a long history of development work in Africa and holds a master's in public health as well. With that, I will turn for opening comments to each of the panelists. Dr. McGregor-Skinner.
Thank you. I'm honored, and it's such a pleasure to be with you this afternoon with this esteemed panel. And I wanted to thank Congressman Fortenberry and for the organizers for inviting us to be part of this. Thank you so much. Project Concern International, or PCI, has been working in Liberia since 2010 as a partner in a USAID Title II PL 480 Food for Peace funded project. With our lead organization, ACDI VOCA, and our partners, John Snow Incorporated and Making Sense International, the Liberian Agricultural Upgrading Nutrition and Child Health Project that we lovingly call LAUNCH, has been providing support to the people of Bong and Nimba counties. LAUNCH focuses on food security in the context of development in the areas of agriculture, health, nutrition, education, disaster risk reduction, gender equity, and youth livelihoods. It sounds like a lot, and it is. But that is the uniqueness of these multi-year assistance programs. They wrap around communities providing complex and integrated services to address multiple needs. The LAUNCH program's disaster risk reduction component has been key to building a foundation for resilience and rapid response to emergencies and shocks that might occur at the community level. In a country that's been blessed with 11 years of peace following more than 20 years of civil war, consistent rains, and almost no natural disasters, this component of the project has been put to the test over the past 12 months with the Ebola crisis. In March 2014, the first cases of Ebola virus disease were identified in 3 West African countries, as we all know, including Liberia. Our project area, which Doctor pointed out borders on the Republic of Guinea, has always been a transit corridor for West African travel and began seeing cases during the first wave. My personal experience with 2 Ebola outbreaks, one of them being in Uganda, provided me with basic information, and our project began utilizing our community groups, which included farmer groups, care groups with lead mothers, community WASH committees, and disaster management committees, to name a few of our groups, to provide key messages in the early days, focusing on safe burials and the handling of the dead. Recommendations not to hunt and to eat bushmeat, and early signs and symptoms of Ebola. The traditions surrounding burials and the preparation of and honoring of the dead are steeped in very strong cultural and religious practices and traditions, and have proven to be one of the most difficult and one of the most successful interventions in the fight against Ebola. A lull in the cases in late April and early May left the government of Liberia, and all of us, quite honestly, breathing a sigh of relief. That respite was short-lived, as we all know, and by mid to late summer, we were in the midst of a global health emergency. Because of our work on the ground, because we were there, trusted, and able to respond immediately, our communities received early training in infection prevention and control. They received the supplies necessary to protect themselves and their families, including hand-washing buckets, chlorine bleach, and educational materials. And because we have multiple avenues for the dissemination of information, over 90% of our more than 700 launch communities have remained Ebola-free from the beginning of the epidemic. The 121 communities with disaster management committees actually set up roadblocks in the entry points of their communities to check visitors and to ensure that these visitors did not have any signs or symptoms of Ebola before they entered. They also tracked these people and basically made sure they didn't stay there at night. Volunteer community health workers are linked to the Ministry of Health and Social Welfare's county surveillance teams and have been doing door-to-door surveillance and follow-up contact tracing when they are notified of possible or confirmed contacts. It would have been impossible to hit the ground as quickly as we did and to have the impact that we've had without the support and flexibility of the Food for Peace office in Monrovia at the USAID mission and the office here in Washington, D.C. This development funding is more than food aid. It is training for parent-teacher associations to improve the educational status of Liberia's children. It's working with a farmer group to grow more vegetables for household dietary diversity and additional family income from the excess. It's a hand-dug well in an area where cholera is endemic. It's provision of antenatal care and safe delivery services for isolated women at the community level. Yeah, food aid is important, and it's key to the immediate response to ensure a healthy pregnancy in the first 1,000 days of life, and to reduce chronic and severe malnutrition in children under 2. But it's so much more than a bag of CSB, corn soya blend. With launch as a foundation, PCI has expanded our Ebola programming and has received additional funding from the Office of Foreign Disaster Assistance to implement county-wide programs in Bong and Nimba, including social mobilization, contact tracing, and rapid response in collaboration with AfriCare and the Government of Liberia Ministry of Health and Social Welfare. We also manage 3 Ebola community care centers, which right now are empty, but we're very thankful that they're there, and the Ganta ETU, Ebola Treatment Unit in Nimba County, which borders the Republic of Guinea, which has had recent and confirmed cases. Our projects continue to support local and national government to ensure that cross-border surveillance is heightened and that border crossings, both at the county level and the international level, have the staff and supplies needed to identify possible cases and make rapid referrals. To address food security issues exacerbated by the Ebola pandemic, PCI has received additional funding from Food for Peace for the implementation of emergency food security project in Bomi and Grand Cape Mount counties. These 2 counties have seen the most recent spikes in cases and have traditionally had very serious food insecurity and malnutrition data from national and international surveys. As you might remember from my introduction, I started my life's path in Liberia as a Peace Corps volunteer. The students I taught more than 30 years ago have survived civil wars and are so resilient that many of them are currently in government service. The unprecedented Ebola emergency has taught us many lessons, and we will continue to learn from it. Resilience is a sustainable change that has many components, including the ability to become strong, healthy, and successful after something bad happens, to properly adapt to stress and adversity, and to recover quickly. Building resilience takes time, inclusion, the will and support of the government and donors, and the incorporation of all players at all levels. It should and must be a component of every project so that governments and communities are equipped to respond to the small shocks that impact on their everyday lives and the larger shocks that have global repercussions. We must learn from projects like ours, document those lessons, and ensure that disaster risk reduction and resilience is an integral part of all development programs. When government services collapse, as they did in this case, communities need the capacity to take action themselves. Thank you once again for the opportunity to speak with you, and thank you for my opportunity to serve the people of Liberia and the American people as well. Thank you.